Hi everyone, welcome to Naturopathic Medicine Week. My name is Dr. Amy Kroeker and I'm a licensed naturopathic doctor here in Winnipeg, Manitoba and in Selkirk, Manitoba. And today I just wanted to pop on and talk a little bit about what is naturopathic medicine. For those of you who don't know and are not familiar with it, it is a system of primary health care. What that means is that you can come to a naturopathic doctor, they can do physical exams, um, they can do blood tests and laboratory testing. They can make diagnoses and treat the basic health conditions that you would see your general medical practitioner for. So your medical doctor is what we typically think of as our primary health care providers, and naturopathic doctors actually fall in that category as well. We have a 4-year medical degree, and that is after our undergraduate degree with science courses and anatomy and physiology and pathology and biochemistry and all of those fun ologies and chemistries and sciencey things like that. Because those are so key to understanding the human body. Anatomy is not different from one system of medicine to the next. So we have to learn about it the same as any other doctor. So when I see patients, I can assess their health conditions the same as your medical doctor would be able to. But the difference lies in how we treat. And so as a naturopathic doctor, I'm looking at assessing a person's whole system. On the first visit, I have quite a long initial intake, and typically naturopathic doctors do. We typically see people for the first visit from anywhere from like an hour to an hour and a half. That's about average. So mine is just over an hour, my initial intake, and I'm looking at every body system. So you might come in with a headache, but I want to know about your digestion. I want to know about your skin. I want to know about your health history. Have you been on medications in the past, or have you had a lot of antibiotics when you were a child? Like, what is it that has led to you being sick in the first place, or to you having what you have now, what your current complaint is? Because if we don't know what the inputs are, then how can we change the outputs? So what it really comes down to in that first visit for a naturopathic doctor is assessing the whole system and looking at the whole body as interconnected. So you may have a digestive problem that actually causes the headaches, or perhaps it's a hormone problem that's causing the headaches. So it's something that we have to look at every system, or else we might miss what's really causing it. There's lots of great natural treatments that can just help with a headache directly, but that's a little bit more like the allopathic Western medicine model, where we have a symptom and we treat it. So the root cause is what we really want to get to. And so that's what I look at getting to every single time I have a new appointment with a patient, and anytime any of my returning patients come with any sort of new issue or a different goal that they want to try to address. So I'm always looking at the whole system and assessing for that. And then how I treat is a lot of different ways. We have a lot of different tools in our toolbox. We don't just have nutrition. We use nutrition a lot because it's something that is what makes us up as individuals. The nutrients and the molecules that we eat make us up as human beings. So it's important to look at nutrition as a key component of our treatment plans, but we have to look at environmental factors. Sometimes we have to look at sleep. We have to look at hydration. We have to look at also sometimes using botanical medicine treatments or supplements that are going to assist the body in getting back to its natural healthy state. And so we use botanical medicines, supplements, nutrition, lifestyle. We're going to look at using acupuncture in some situations. Sometimes we'll use homeopathy. Sometimes we'll use IV nutrient therapy for more intensive cases that we need to get quicker results with. So we have a lot of different options to treat at our disposal. And that's something that I'm super excited about, because I can match the treatment to each individual, and it's not going to be the same. There's some similarities. We know that healthy diet and fruits and vegetables and things like that are healthy for us in general, but it's the specifics that I love diving into for every one of my patients. They come in, they sit down, they tell me about what inputs have led to the outputs, and then I look at what's going to be the most specific for them. Sometimes I need to do testing to do that. If I need to dive into hormonal testing, we have some amazing tests to do that. Some mental health tests with anxiety and depression that I love. I love to know exactly what's happening with the neurotransmitters. So I test for the neurotransmitters. Are you actually low in serotonin if you're feeling depressed? Some people, yes. I personally tested quite low in serotonin last year, and so used some different natural therapies to help boost that, and it made a huge difference. But not everyone is low in serotonin when they come in with anxiety or depression. So testing is so important. So I'll do a lot of specialized testing. I do food sensitivity testing to see what's happening in the gut. I'll do gut parasite testing, stool testing to make sure that there's nothing going on there if needed. And really we'll just tailor what tests need to be done or what tests have been done by your medical doctor already. Sometimes standard blood work doesn't need to be redone because it's already been done. And that's where I collaborate and use the benefits of working together with your medical doctor to get you the best healthcare possible. But what I love is just like designing the most specific program for each one of my patients and doing that from a natural perspective, something that is going to boost your energy, give you back the optimal health, not just the not sick health, because not sick is way on this end of the spectrum. Super phenomenally healthy, energetic, radiant, living life to the max is on this end of the spectrum. And a lot of people are somewhere in the middle and struggling because their lab tests show that they're not sick, but they're not healthy either. So that's something that I always have to explain initially, because what I want that optimal life for all of my patients. I want them to feel fantastic because it'll overflow into everything they do, their relationships, their energy at work, their income level, even if you think about it that way. And so I want them living that optimal life, and I want them to live that as long as possible. And then, at the end of life, we have different issues, and even those we can sometimes help to support to get better quality of life. So it's about a combined approach, but it's about looking at the whole body. And that is just something that every day, honestly, it's just such an amazing field to be part of. So I hope that this helped you to understand a little bit more about naturopathic medicine. I really enjoyed making this video, and I hope you'll tune in for more videos this week about what naturopathic medicine is, what different types of things we treat and how we treat, and I hope this gives you a better understanding of the profession as a whole. Follow me at Tier 1 Health on Facebook or Amy Kroeker ND on Instagram, and check out more all this week. See you soon.